I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
Welcome to this episode of IDD Health Matters. I have a really exciting guest today who is doing some wonderful work and changing really the way people see people with intellectual and developmental disabilities. Rick Guidotti.
Hi.
Welcome, Rick.
Oh, thanks, Craig. Thanks for having me. I'm very excited to be here.
Well, look, I just want to start by turning it over to you to tell the story of Positive Exposure and the amazing work that you're doing in the field.
Okay, well, Positive Exposure is a nonprofit organization. I'm the founder. We're a nonprofit organization that promotes a more inclusive world through photography, through film, and through educational programs, working with communities around the globe that are at risk of stigma and exclusion, celebrating the beauty and richness of human diversity.
That's beautifully said, wonderfully said. How did it get started? How did you come to do this?
Yeah, it just kind of fun. I'm based in New York City. I was a fashion photographer my whole career, working in the industry, living in New York City, but working and living also in Paris and London and Milan and Italy. And it was fantastic. I was working with great clients and great models, and it was fantastic. But it was really frustrating because I was always told who was beautiful. Yeah. I was always told who the face of the season was, who we had to photograph, and we'd run and photograph that face, and it would change the next season. And what was so frustrating about it, although it was really exciting, but it was really frustrating, is I was always told who was beautiful. I was always, I'm an artist. I don't see beauty just on covers of magazines. I see beauty absolutely everywhere. I was leaving my studio one afternoon in New York City after doing a casting for Elle magazine. Walking down Park Avenue, I spotted this kid waiting for a bus, and she was beautiful. She had white hair, pale skin. She had a genetic condition called albinism. Albino was the common term. Mm-hmm. But I never met a model that looked like this kid. She was never included in the beauty standard. When I went to research this condition, I knew it was genetic. When I went to research, I went to medical textbooks thinking that's where I'd find images of this gorgeous kid or friends of hers that shared the same.
And that's not what you found.
That's not what I found. I found these horrible images of just really images showing specimens or people usually up against walls in doctors' offices with black bars across their eyes. And just that was it. It was horrible. Not this gorgeous kid or this breath of fresh air I saw waiting for a bus. It was just these really horrible images. And I knew I needed to change that.
And you've done tremendous work to change that. I don't know if any of you have ever seen the photos, but you've got to see them. They're incredible. So you work a lot with medical schools and medical students now, right?
Yeah, we're now probably more than half the medical schools in the country. And we also travel around the globe as well, working with healthcare providers in training, really creating opportunities for a healthcare provider in training to learn early in their training. And it's never what you're treating, but always who you're treating.
Can't echo that harder. I mean, people first. We have to see people as people first for us to put a value on human life sometimes. And the work that you're doing in this field is certainly doing that. So I know you do the photography, you do videos.
And next, okay, so Frame, we have a series of films called Frame, Faces Redefining the Art of Medical Education. Very brief films, 10 to 12 minutes long, presenting all the basic hallmark characteristics of a certain diagnosis or topic, but as presented by somebody living with that condition or that experience themselves. So placing front row and center in medical training, humanity.
Wow. So where do you find your subjects?
Oh, we've never, that's a great question, but we've never solicited. We're always, for the last 25 years, we've been in existence, working with advocacy organizations around the globe. They call, they say, can you come and work with our community? And my answer is always and will always be absolutely yes, I'm on my way. And that's what we do. So they actually identify themselves, the advocacy groups. I'll go to a family advocacy conference. They're usually from June through August. I go to tons of them in the summer months. And I create all these images, and then I gift the images to the organizations, the advocacy groups themselves, to use the images without restriction, helping to change the way that they are presented in the medical field, in medical education, but also in the broader public arenas as well.
I see the images in people's faces just light up, and I bet it's a great experience for them too. They seem to really enjoy the process of being photographed.
Really glamorous. It's kind of fabulous. It's always a fun experience. So it's never like you're not going into like some studio and sitting down and I only use natural light. It's all very fun. It's always very glamorous. It's really still, but it's always about giving somebody the space that they need to see beauty in their own reflection.
Yeah, and people living in real life, doing real life things.
And also looking fabulous. And remember, I'm really shallow. It's about beauty for me. It's really about beauty.
Yeah, you're so shallow, Rick, really. No, it really is incredible work. So if people want to see your images, what's the best way for them to see?
So we have a very active website. It's positiveexposure.org. Everything's there, all of our programming. We're introducing a new platform. Since day one, when I saw that first medical textbook, and it was terrifying, I've always been after trying to change and create an alternative to those dehumanizing, absolutely dehumanizing medical textbook photographs. And we're creating a platform now for healthcare providers in training to access, and also faculty to access, images of humanity. And we're calling it's a great name. It's called Textbook Beauty. It's so fantastic. It's like the greatest. So it's really cool. So we're just about to launch out. Our website is very active. There's a lot of images, a lot of galleries. All of our films are there. We have another program called the Pearls Project, which is an online blog platform where it provides an opportunity for our ambassadors around the globe to talk about life from their unique perspective. It's kind of amazing.
I bet it is. I can't wait to see those. I haven't seen that yet. I was talking with one of the medical students that you were working with recently. It was telling me about this new project. And so it's really going to be kind of a repository of images that show people in a positive light who have various conditions to hopefully replace those old terrible photos.
Absolutely.
In medical literature and textbooks and all of that, and then just make it available everywhere. So that's fantastic. What's next on the list for you, Rick?
Wow, we're really exciting. We opened a gallery 4 years ago, so a multimedia gallery and performance space in East Harlem, and we're looking to it. And we've kind of outgrown the space already. We're in 2 floors. It's this great space, beautiful gallery, really accessible. It's gorgeous, but we've outgrown it. So now we have so many artists are coming to us, and so many schools and artists in training and performers and theater companies. We have an in-house theatrical and poetry group called Outside Voices, because they refuse to use their inside voice. They're all adults living with IDD, identifying as having an IDD, but really out there changing the way the world sees their difference and hears about their world. So we found a new space. We're looking. We don't have the leash yet, but hopefully when this airs, it's fabulous, amazing space right on Fifth Avenue in East Harlem. Again, it's really incredible. I'll show you a photograph in a second.
Yeah,
it's so incredible. But so the idea is just to have much more visibility. We just received a grant from New York State Council for the Arts. It's a 3-year grant. We're already into our 2nd year. But creating a space for healthcare, for artists with disabilities and non-disabled artists to collaborate, to create opportunities to raise the visibility of our disabled artists on the stage, on the screen, in the broader public arena. This space is the real deal, and it's going to be just so extraordinary if we get it. So I'm just hoping.
I hope you will. That's definitely going to be worth a visit. I'm gonna.
Yes. Oh yeah, you must go. Yeah, for sure. Everybody go. You're all welcome. Come. I'll give you keys.
Yeah, sounds great. That's super exciting. One of the things I like to do is ask guests to tell us 3 things in 3 minutes that you think can change the world in a positive way for people with intellectual and developmental disabilities. What words of wisdom do you have for everybody?
Wow, that's fantastic. But it's more observation. I don't know whether I have words of wisdom, but more of an observation. No matter, because the truth of the matter is, around the world, we are all united by our differences. We're not divided by them. And so it's our differences that we need to celebrate every second. And no matter which continent I'm on, which country I'm in, which culture, which language we're speaking, we all of us share the exact same need. And it's a need to be seen, a need to be heard, and a need to belong. It's as simple as that.
Wow. Be seen,
be heard,
belong, and belong. Couldn't have said it better. And that's just wonderful. Rick, thank you for taking the time to talk with me today, and thank you so much for the incredible work that you're doing, and I can't wait to see the future and what's next.
Yeah, thank you, sir. Thanks, Greg.
Thanks.
Wait. Gillis.